Dr. Ayman Attar. So, Dr. Manar, it's all yours.
Yes, thank you so much. Good afternoon, good morning, good evening to all. Today it's my big pleasure to introduce all our speakers in our webinar. We will start with Dr. Ayman Attar, and Dr. Ayman Attar, he is more than welcome and the most famous doctor in this field. Dr. Ayman Attar, he is the president of American Association of Aesthetic Medicine and Gynecology. And he taught many doctors worldwide for aesthetic medicine and aesthetic gynecology. He is the founder of the first Cosmetic Gynaecology conference that is held every year in Dubai, ICGC. So more than welcome, Dr. Ayman, and we are today too much happy and glad to hear and listen from you.
Thank you very much. Can you allow me to share my screen, please?
Yeah, sure. Dr. Ayman, I'm making you the co-host, right? Yeah. It's you are now co-host. So.
Okay. Very good. So let me know if everybody can see my screen now.
Yes.
Yes.
Perfect. So first of all, I would like to thank my brother and friend, dear colleague Prabhu Mishra, for his extensive work and extensive ability to spread the knowledge worldwide. And I am proud to be part of this meeting. So I guess the topic that we'd like to start with is female genital aging, to understand what actually we are tracking and what actually we're treating in functional or cosmetic gynecology. So the most important thing to understand that the lifespan of women in 1917 was only 53 years. So women who lived 100 years ago did not endure menopause, genitourinary symptom menopause, SUI, and all these problems. But looking at current dates here in 22, we have now almost 900 million menopausal women on planet Earth that will live for another 30 to 40 years past the menopause. This number increases 20% every year because the baby boomer population maturing. In the year 2025, we'll have 1.1 billion menopausal women. And that show the necessity and the significance of this new subspecialty in gynecology to give them a normal life. So to understand what is happening, whether it's a female or a male, now the settled theories of aging and demise include DNA and genetic theory, telomerase theory, neuroendocrine theory, free radical theory, cell membrane theory, cross-linking theory, and mitochondrial DNA polymerase defect theory. So let's start with the chronological versus biological age. Chronological age is the age in your passport where you're born, but this usually doesn't coincide with your actual age, which is the biological age determined by the amount of methylation of one of the 4 amino acids that constitute our barcode, I call it, adenine, thymine, cytosine, and guanine. So methylation of the cytosine contribute to aging and eventual demise of the individual. Progeria is a rare genetic abnormality where babies age rapidly and dies prematurely. It was described first in 1886 by Jonathan Hutchinson, and he discovered it's an autosomal recessive genetic inheritance where the inflicted individuals will mature and die within 10 to 15 years of birth. So that gives you a significance of what aging is inflicted by chromosomal factors. Aging is a simple disease. I call it senectus ipsamorphus. It's not my word. It's the word of Terenzio Afro, a poet in the comedy Formio 160 years before Jesus was born. Today, 125 million people are over 80 years old. By 2050, the world's population aged 60 and older expected to total 2 billion from 900 million only 5 years ago. By 2050, there will be 120 million living in China alone and 434 million people worldwide. By 2050, 80% of older people will live in the low and middle aged income. As you see, there's an exponential increase in the lifespan all over the world. In 2003, the Genetic Human Genome Project deciphered the sequence of human genome. Encoded DNA information controls aging that differ from one individual to the other. So what happens with the chromosomes? What happened with the DNA? Our DNA is oxidized and damaged by diet, lifestyle, exercise, toxins, pollution, radiation, and other influences. But we have an inherent protein on the chromosome that's called PARP1 protein that is supposed to be fixing the changes that happens in the chromosome on nanosecond basis. Unfortunately, there is an accumulation of another protein with time, chronologically called the DBC1 protein, that marries this PARP1 protein, preventing it from doing its function. So if we imagine we have this magic cure that can splice or split these two proteins from each other, then we're gonna relieve or release PARP1 protein back to its coitus. Sex is uncomfortable because of that lack of natural padding, and that's why we try to increase the volume of the labia majora using autologous fat grafting or sometimes hyaluronic acid fillers. Reduction of the content of the smooth muscles, histological evidence in 50 women studies show loss of average of 50% of the tissues of their cavernosal bodies and contribute to age-associated arousal. Again, this is a sign of vaginal atrophy with lack of trophism in the mucosa, seeing the vessels, patches of less hydration, less elasticity, appearance of fissuring and introital contraction. And lastly, clitoral aging. The clitoris hood will shrink, retract, given the appearance of a clitoris larger, but the sensitivity of the clitoris itself and the 8,000 nerve endings that are associated with it will be much less. Thank you very much for your time and for your listening. Thank you so much.
Thank you so much. Thank you, Dr. Ayman.
Thank you very much, Dr. Manar. Thank you very much.
So, Dr. Prabhu?
Yep. Thank you for this wonderful talk, Dr. Ayman. Let me see if any question into the chat box.
Yes.
Yeah, apparently we don't
Question?
have questions. And Dr. Ayman, it was a really amazing presentation as usual. It's not first time like we hear each other for the last 7 years.
Thank you, Prabhu. Thank you so much.
But I'd like to ask one question. What's your opinion about the BHRT is one of the key component nowadays coming for female genital aging, bioidentical hormone replacement therapy? What's your comments on that, especially like a few of the slides was mentioning about the estrogen and you talked about the melatonin and the DHEA doses. Like what's your opinion about the perimenopause, menopause, or early menopause with the BHRT management?
Okay. My comment is very simple. Let's all think out of the box. Everything that we know about medicine and about advances and about Zoom meeting between you and me happened in 100 years of 6.5 million years. So we're still at the dawn of science. What makes sense is that if you want to elongate the longevity of the human specimen or have a perfect normal life, you always have to be physiological. All of us know there's a very large population taking Synthroid for thyroid deficiency, thyroid hormone deficiency. So we always want to keep the individual, whether 20 or 200, in the normal range. Never exceed the normal range, never overshoot the normal range. That's why somebody like me, refer my client or my patients to a person who is specialized in bioidentical hormone replacement therapy. It's a different specialty that has its training and its courses and its laws. But definitely, when you normalize the hormone of the individual at the age of 70 or 80 postmenopausal, you bring her back to the normal range of a 20 or a 30 or a 40 years old, and that is the maintenance, what we call the chemical or homeostasis internally. As plastic surgeon, cosmetic surgeon, we try to do the morphological or the outside. But what about the inside? Important part of the inside is to give the body its natural normal levels. Again, with process of aging, like I said, four things happen: decrease of all the hormones. So you try to replace that with an expert to keep it within the normal range, not overdo it or overshoot. Number two, enhance the receptor sensitivity, like a drug like a metformin. Number three, reduce or control the excess cortisol that causes the aging. And when you do all that, the feedback mechanism between the different components of the neuroendocrine system will normalize. So I am a very big proponent of this PHRT if it's done by an expert who is well trained and well versed in the specialty.
Thank you. Thank you so much for your wonderful comments.
You're
And meanwhile, let me check once more if we have any questions. Dr. Ayman is with us for another 2 more lectures. He's going to talk on the Botox and the filler. But because it's a very early morning for him, 5:30, let's have yourself a coffee meanwhile. And
I'm trying to sip on my tea here.
And this is the little bit of token of appreciations for your presence.
Thank you so much. You're always very nice and very sweet to me. I love you from the bottom of my heart. Thank you very much, Bill.
It's my pleasure to